ว่าประมาณมาตักผู้ประบาเขาดูแควลคิกิมแควลคิกิเนี่ยโอราแล้วเฟมซีเกแล้วโอพีดียีดันเกแล้วโอพีดีบุคคลเนี่ยโอราตะชิคุอ่ะเป็นไม่ว่าเราปวดชาให้เขาดูเนี่ยว่าจะเลือดรอบอ่ะ
Like in any other hospital, the outpatient department is the busiest place at the Mae Tao Clinic. This department sees close to 32,000 patients annually, about 70% of whom are migrant workers and 30% Burmese residents. A small pharmacy dispenses basic medicines like antibiotics, malaria, and asthma medicines. These are free to all patients, but stocks are limited. Strict regulations on medicine donations, funding restrictions, and the lack of alternative funds all challenge the clinic's ability to provide adequate medicine to its patients. Most patients have very low education and literacy levels due to the inadequate and underfunded education system in Burma. A public relations group helps patients with the registration process where basic information is recorded. This is a typical village of migrant workers in the border region. The migrant workers and internally displaced people live in very difficult conditions. Poor hygiene practices and limited access to clean water and sanitation lead to a host of preventable diseases. Many patients face great difficulties along their journey to Mae Tao Clinic, and by the time they arrive, their illness is often in an advanced stage. In many cases, particularly when malaria is suspected, patients undergo blood tests.
ที่ไปปวดชาไม่กี่ปวดชาไม่ว่าไม่กี่แพ้แล้วแฮโอพีดีสำหรับที่บ้านเราวันที่สุดเนี่ยตะกุบากุเตะเราตัวหลอกกาแต่ที่นั้นนับเปล่าบ้าขาเราต้องเอาชูคลีร์ป่าเราตัวหลอกกาคนนี้แต่ตัวมือสิก็ว่าเรามาเจอว่าแต่วันที่เราตัดไผ่เราผมไม่ว่าเราไปที่บุกก็เนี่ยแต่รู้ว่าบ้าขาเราตะกุบากุเตะเราต้องเอาชูคลีร์เนี่ยเรียดูกับตัวเราคนจะเรียกยี่ห้อเนี่ยอะไรกัน
Diarrhea, abdominal pain, and acute respiratory infection are common in the outpatient department. But over the years, the clinic has seen a steady increase in the number of cases with chronic diseases such as diabetes, hypertension, and asthma. It is believed that substandard working conditions and poor health and safety practices by migrant factory workers and farmers are the contributing factors.
It is little opportunity for the Burmese people inside Burma as well as in Thailand. So we try to establish a training program for the young people who could not access education in other areas. So after training these young people, they learn from each other about cultural as well as the medical issue as well as some social problems. So finally they can go back and work in their community and use their knowledge and to promote the health status of their people as well as to strengthening their network among the health professionals and the community.
The four main training programs conducted at the clinic focus on primary health care, reproductive health, primary eye care, and laboratory management. People traveled from all over the border region to study at the clinic. Since 1992, approximately 400 healthcare workers have been trained. Courses usually run for 18 months and include at least 6 months of practical work in the clinic.
We have selection criteria. They have different ethnic people, and then they come here. We take 1 or 2 people in different ethnic people, and then we have training about medic. And after they finish, the ethnic people go back to their community and work as medic.
Although most medics trained at the clinic take their skills back to their communities inside Burma, some stay to help with the overwhelming flood of people in need of medical care. All of the medical staff at the clinic have been trained here, and for security and financial reasons, they live communally on the premises.
Yeah, we work here as volunteer, I think. We have not much money for buying other things like that. We have only for using in our daily life, just for daily life. Not much, but we enjoy our work here.
This sentiment is shared by the other clinic staff, but they're not the only heroes. The lifeline of the clinic is, of course, the laboratory and blood bank. Lab workers conduct 800 to 1,000 blood transfusions per year, screen about 23,000 slides, and process blood donations. With limited equipment and storage facilities, the clinic relies heavily on the regular blood donations from the community. This provides an excellent opportunity to educate people about infectious diseases.
Emergency blood per health worker
All donors receive information pamphlets, fill out risk assessment forms, and undergo pre-test and post-test counseling to prepare them for the procedure and to raise their awareness about infectious diseases.
Pre-test counseling adu permit to do the basi with ata chaye kama baha ta chaye ka baha la tui ni pe sira ta chaye ka then HIV the hepatitis B hepatitis C VDRL and malaria basi with ata chaye kama ta chaye ka ne adu ba du tinya awete mo awete klu wete ma buti wane ba mle tan no ne te tulu ba di ko oji ma tan no ne tulu di oji.
Strict pharmaceutical restrictions on cost and quality of blood screening are a constant challenge. However, the Mae Tao Clinic's comprehensive HIV prevention program incorporates safe blood donation and voluntary counseling and testing to help ensure that the blood department provides a safe and adequate blood supply to its patients.
Jemada pay ni muma bam no kulene bole papa copy phone mo bahale awani ta cha HIV mege mo bahale penya pe mege awetini bamle arkini tanapa we ba mo bole permite ni HIV ta cha na hu ba la mo tana kini akuse ti cha le bole ba troso cha le ne awete penya ba.
Years of civil unrest and military action in Burma have left the ethnic minority communities living in a veritable minefield. Simple tasks like gathering food or plowing the field are hazardous. Substandard living and working conditions for migrant workers in Thailand contribute to work-related injuries and domestic violence. surgical department of the Mae Tao Clinic provides trauma care and a range of minor surgeries.
This is our surgical room. The patient who come with hernia and hydrosis, and vasectomy and amputation, and then we do it in here. Yes.
Hydrocele, hernia, and abscess drainage are the most common surgeries, but trauma cases are on the rise. Severe burns, accidents in the workplace, and injuries resulting from domestic violence contribute to about 80% of the trauma cases. Although the number of war injuries is declining, landmine injuries are still common.
This is my patient. He stepped on landmine inside Burma for 3 years ago. He has amputee. He has amputee her leg, both legs, from Mae Sot hospital. Some of the patients they got landmine injury, but they stay at home for a long time. And then after somebody, for example, after somebody they arrive here, we can do here because of getting infected. Then we refer to Mae Sot hospital. If they step on landmine today and then they send here today, and then we will do here like amputation.
This story is common with all the departments at the Mae Tao Clinic. Only minor surgery is possible under the challenging conditions and limited resources. All departments at the clinic have to refer major cases to the Mae Sot hospital, like complex and emergency surgery and cesarean sections. Okay. Amputees at Mae Tao Clinic have access to some of the best prosthetics being made in Asia. Forged in a workshop at the clinic by well-trained staff, prosthetics are tailor-made at a fraction of the cost of commercial ones. Over the years, the design and materials have been refined to suit the rough mountainous and jungle terrain of the border area.
It seemed to me that more people coming here to our workshop, so I think that our product is good quality for them and stronger and more lasting for that.
All the staff in the workplace are amputees. Having first-hand experience with the patient situation, they are able to effectively fit and adjust that prosthetic to its maximum comfort. Being mainly an agricultural people, Burmese workers and farmers need to remain mobile.
Normally people inside Burma, see, they have to earn their living. They have to ride by themselves. So, I mean, especially for the male, see, so they are the head of in their family. So if they got accident, it's a big problem for the family too. So after when they got processes, so they feel they have confidence like before.
Confidence and mobility are vital to an oppressed population with few resources and opportunities. A sense of independence is important.